All right, you guys, Ralph Havens here, Beyond Limits Physical Therapy in Bellingham in Fairhaven, Washington, and Trailtown, USA. And I'm with Dr. Tom Giammatteo. He's from West Hartford, Connecticut, one of my teachers and colleagues and friends of many, many years, integrative manual therapy, developer of that with the late Sharon Giammatteo. And today I want to talk about running and running form and something very particular for elite runners and high school, college, middle school runners that want to get better. We have something that's a little different than, quite a bit different than the traditional stretch and pull and massage out stuff. And I want to talk to Dr. Tom about it because there's something that we have about improving running form. So thank you for being here, Dr. Tom. Good to see you.
Hi. Hey, Ralph, how are you?
Very, very good. And yeah, Dr. Tom was the Olympic doctor in Atlanta, I think, right? 96?
I got invited to the 1996 Olympics, and we had Mary Ellen Clark participating in high platform diving at that time.
Oh, nice.
She was on her third Olympic Games at 28 years old, and she had vertigo for the last 4 years.
Right.
And what had happened is she went to the U.S. Olympic Center for the doctors to work on her to fix her vestibular mechanisms. Vertigo or dizziness or Meniere's syndrome are all on the same spectrum of issues. And part of our hearing system on the vestibular system, and it's a cranial nerve also, is taking our balance. And we have three very specific little circles that intertwine each other. And there's three little stones in them, and they roll back and forth. And as we move our head, we have one on the right side, one on the left side. As we move back and forth, it actually tells us our spatial awareness in place. And a couple things about being a high board diver. You know, the 10 meter is 30 feet in the air, and they jump off a concrete platform. So the impact on the water becomes really hard at that point, is about 70 miles an hour.
Holy cow.
And so imagine doing that since you were 10 years old. And so the first day Mary Ellen came into the clinic for Dr. Upledger at the cranial sacral clinic, if you touched her head and if we compared it to a melon or a cantaloupe or like a honeydew melon or a watermelon, Mary Ellen's head felt like it was between a super big grapefruit and a cantaloupe instead of being a nice honeydew melon because of all the impact she had. Right?
It's harder, yeah.
So again, she went back to the Olympic Center and they did the technique for vestibular mechanism. One of them is pretty famous, is called the Epley maneuver. And they reset it for a minute or two and come back. And then they did a procedure where they put hot water in one ear and cold water in the other, and they spun her around for 20 minutes and said, don't lie down for 3 days, and it should take care of everything. And that still didn't do it. So she found us at the Cranial Sacral Center at the Upledger Institute. And she came in and she got about 20 hours worth of work. And we got all the bones of the cranium to move, and that circle got decompressed, and she placed third that year in the Olympics.
That's so cool. Yeah, finding the root cause and then doing techniques to help the body fix it up. That's integrative manual therapy. So that's
so we're going to future talk. I know this talk. I know where you're going to go with this talk, and so that's Western medicine tried to use a hammer to smash it out.
Yeah.
And we went in the other direction called indirect to unhook it and break the scar tissue down, not even break the scar tissue down, allow the scar tissue to untangle itself so that it can come back to a normal place in the body.
Yeah, I just did a talk for our Fairhaven Association and talked about it's kind of like having it's not exactly like this, but having a yo-yo with a string that's all jumbled up. And instead of trying to just force the string to unjumble, you just hold into the string and let it unwind. There's this idea of like watching the body unravel if you've got the right technique going on it.
Yep.
Yeah. Well, very cool. Well, I'm going to talk about runners, middle distance and long distance runners. And my friend said, Ralph, you got to compare, apples to apples. We're going to compare an all-out mile at happened in July 5th in Eugene, the Bowerman Mile, where Yard Naguse was going for a world record. He got nipped at the line by this guy, Laros, Niels Laros from the Netherlands, and they ran 3:45, not a world record, but really, really fast. And I'm going to show you the last 100 meters of the first lap. So from 300 meters to 400 meters. I'm going to show my boy Ben. He was just at a PR mile, 4:51 as an 8th grader. And we're going to show that same segment from 300 to 400 meters. And I showed his little brother, who's 8 years old, and his little brother's friend, and they could see the difference. And I want to talk to Tom about what we did, because it's not stretching, it's not traditional chiropractic manipulations. There's something else, and it's what we call indirect methods. There's a way to work with the body and to improve what's called space. So I'm going to show this and then Tom hasn't seen this video yet, but I'm going to show him this and then let him tell us what he sees. This is the best in the world, and that's Yard Nagusin second. The first guy's a pacemaker, and then Cole Hawker, who ended up winning the 5,000 and is also an Olympic champion in the 1,500. Kipsang from Kenya. And here they are in slow motion. And so Tom can tell us what he sees. And so that's, they got really great strides. And I just wanted people to see like the distance between the front leg and the back leg, like the thighs, and how much space is in their body, and how they're bouncing, how much propulsion they're getting. And so that's the best in the world. Again, the guy in 4th right there was later Olympic champion, was Olympic champion already, and then became an Olympic champion again in Paris. So that's those guys. Now let me go get my son and see what Tom thinks about this. This is my son in that same segment of a race. And there's this stride length and the distance between his front leg and his back leg, the thighs, and the space in his body. I'm going to show one more video later after of stuff. So I can show those again, Tom, but what did you see as far as like the world-class guys that do a lot of stretching and other things, great things, and then Ben gets a lot of integrative manual therapy. Did you I can show those again. What did you see? I can make.
Well, in the professional group, their thigh isn't really crossing midline and going backwards, so they don't have any hip extension. They're so tight in that area. So there's minimal. So Ben is going from flexion into extension, and these guys are just barely making it into neutral position.
So watch that again. Here's the world-class guys.
So as the first guy puts his foot down, now he comes across, his right shoulder has to rotate down because he's not really getting true hip extension in his legs. So if we're looking at knee width to knee width, especially his left leg is really tight, he can't manage to get that backwards. So they're running, but they don't have full potential of their range of motion that I'd like to see that Ben does have.
Let me show you again. And the guy in second, the first guy was a pacer, so he was going to drop out. So the guy in second is an Olympic medalist. The guy in 4th is an Olympic medalist. What do you see with those guys?
Still not good hip extension.
So even with all the work they get?
No. So they get maybe 5 degrees, 10 degrees out of the hip extension, and they're a little bit more flexible than the other one, but yeah.
Yeah, so their thigh doesn't go behind their hip as far as we would like. Now let me show you Ben again. We'll just go through it because it's subtle if you're not used to seeing this sort of stuff. But to us, it's like very important, very big. Let me go get Ben here. So we'll just watch him get onto the screen. So Ben's the first guy.
And you could see his space of leaving the ground is much more longer, right? So
yeah,
he's got some more better air time than they do.
And his hip is going behind him a little bit better, it looks like.
Yeah, about 10 to 15 degrees better on that whole piece. You see him his shoulders don't fall forward as he's propelling himself through the body, and the stride and the airspace between foot strike to if we go back to the other one, Ralph, one more time, they're it has a big circle from, heel strike to toe off to heel strike again. Ben has a glide in between those. He's like just floating across that whole piece.
Yeah, he's floating and gliding across that.
And number 2 and number 3, they're shortened, right? That knee doesn't come fully out into extension as much as
Oh,
Ben.
it kind of stops. Yeah.
Yeah. And again, every time he has to get that knee up into a knee flexion, it pulls him forward. So he's sort of like fighting himself. The top's a little bit tighter than the bottom.
And these are some of the best guys in the country and in the world. They have medaled in the Olympics and world
Yeah.
championships. So there's that. And then we'll show Ben one more time. And I'm going to ask you how, because I get the luxury. Ben loves it. He's like, Papa, can you work on me today? And I love working on Ben. But we work on him 3 or 4 times a week doing, we don't do stretching. We don't do massage. We're not trying to manipulate a trigger point. We're doing what's called indirect techniques. It's from integrative manual therapy. So can you talk to us about the difference? Like these guys obviously have great coaches. They get great physios, massage therapists, chiropractors. I see them using the thumper machines and they're rolling out things. And, you know, tell us about how did we do that with Tom? I mean, with Ben, you taught me these things.
So if you don't know what you don't know, the technology that's been around has been around for hundreds of years. It started off as gua sha in Chinese medicine, and they took pieces of rock and started stripping things back and forth. And what we discovered, originating with Dr. Lawrence Jones, and December 10th, I'm actually flying out to Taiwan to teach out there for 2 weeks to the physical therapy board out there. We're going to do 2 classes of advanced strain, counter strain. So as if we go into super detail, and I'm not really sure if the doctors of physical therapy of today, which is a relatively new position for physical therapy, they're now called doctors of physical therapy, and you and I just got a bachelor's in it, but I feel we had more skill sets and less paper knowledge than what they consume today. So there are receptors in both the muscle belly and the tendons that measure proprioception, or where our body awareness is in space. And those are used to tell us if my hand's up or down, behind my back, scratching my nose. It's all those precision things. So when we're doing ballistic or quick sports, when we're watching Ben run and watching the others run, the guy's 100 pounds, so that foot has to take the weight of 100 pounds, and the quadricep has to really slow down and take it. That time after time, he's going to blow out his circuits that measure his proprioception. So the flexibility isn't there because there's a hypertonicity, right?
It has to be tense because it's hitting the ground.
Right. And we can go back to our clinical research, which is, we didn't do a study on it, but we have a history with it, that through 2007 to 2010, the University of Tennessee's women's basketball team, the coaches were studying with us and using us as their therapist, and we went in and taught them the techniques of advanced strain, counter strain, and strain counter strain, which resets the spindle so that the muscle is there. So in my career of 50 years of doing biomechanics, I can virtually take probably 90% of the population and have them touch their toes, right? So our hamstring flexibility from 0 to 99 years old should be enough that we can stand up, keep our knees straight, and touch our toes. And when people say, well, my father had tight hamstrings and I have tight hamstrings, and we're always going to have tight hamstrings, and we've done all these techniques and they still stay tight, and other people can touch the floor and put their head between their knees, the person that can't do that is not optimally using their muscles, right? And advanced strain, counter strain, and strain counter strain can reset these spindles and reset the Golgi tendon organs, where with the thumper or the ice or the shockwave. We're smashing these things, putting them in the shock, and we'll get a little better flexibility. We used to do contract, relax stretching, which most of us know about, which is you lying down, somebody puts your your leg on the other person's shoulder, and you get them to the point of where you can't bend it anymore, and you ask them to push down, and then they relax again. They can get up a few times. That's working some of the spindle action, but it's not resetting it. Whereas strain counter strain techniques and advanced strain counter strain techniques are coming in there. So Ralph, you and I see the hamstrings being tight to protect something, and there's a dysfunction. So the body doesn't want to have to tighten the hamstring unless it knows it's going to get other damage. So
Yeah,
go.
and then when you do this indirect method, this where you reset the spindle instead of trying to pound it or stretch it, there's a thing that happens, and we can look at the video again. There seems to be more space in the body, like it's like they look a little more compressed. Even the super fast guys compared to Ben,
Right.
there's a space that happens.
Right, and we talk about three-dimensional space throughout the body, and he's actually having his joints, Ben's joints are actually having almost like an air cushion between the knee and the tibia and the fibula, sorry, the tibia and the femur bouncing up and down. And these other guys are having non-joint space. So we have about 5 different techniques going in, one for the joint space and creating three-dimensional space.
Yeah, I'm just showing it again while you talk.
So you can see that again, the stride length back is tighter, and their stride time is a little shorter, right? You can see them using their feet more, but they don't have that glide, that um, um, antelope bounce that Ben has in their stride. So Ben's flying more than they are in the running stance.
And we'll talk about, I'm going to really use your expertise and talk about this idea of like because there's other techniques besides the strain counter strain, and they help with the space, which is quite interesting. So this is like
So
this.
you can see his gliding time is much, right? He's almost like floating in air there,
Yeah,
right? And there's no upper body, and you can see how far his knee extends behind his buttocks.
yeah,
His knee goes forward. So he's actually has a fully extended leg when he hits the ground compared to the other guys there. And you could watch that second guy coming in, and you saw that he was that shorter knee stride strength.
yeah. I'll leave him off the discussion too much because he's like our little buddy. Yeah, but yeah. So so we've got this idea of and it's in the scientific literature, right? Like this idea, like if things are aligned and you do these kinds of mechanisms that we talk about to restore the muscle spindles, that there's some research, I got to find it again, but of like when it's like in that sort of arrangement, the tibia and the femur come together, and there's an instantaneous packet of energy, right? There's something that happens in there.
Yes. There is a phenomenon, I'm forgetting the name of it, but you could do it with cornstarch and water, where if you try to push on a wet cornstarch very quickly, it turns into rock. And then as you gently put your finger in it, you can go all the way to the bottom. And that has a scientific name. So the synovial joint fluid is the same way. When we compress it quickly, it turns into a solid. So the cartilages are not even really touching each other. They're gliding on the synovial fluid that turns to a solid. And then as they decompress, it breaks up and resets again. So this is my statement is that I've learned hundreds of types of ways to mobilize a joint, from manipulation to mobilization to scraping to foam rolling. And they really only get a little bit of the glide better, but they don't talk about how the joint should be up and down, have a compression so they're gliding on air, or they're gliding on the liquid fluid in there. And this January we have a class on biomechanics, which we call Helix Energies, where we create that. So our
Love
fourth
that
book,
class.
our third book on biomechanics, and muscle energy and beyond was the first one, and Dr. Mitchell, Fred Mitchell, was the creator of that space.
Yeah.
And he used long lever arms to get there. So you had to like get the person up and you had to hold this heavy arm. So we worked on that, and Sharon wrote her first book in the end of the 80s called Muscle Energy and Beyond, where he included a lot of sacrum work. And then in 96, we wrote the book with synchronizers and a couple other things. And then after we wrote the book, we started discovering these energetic phenomena that would inflate the space even better and faster.
Yeah, because you're a chiropractor and you learned how to manipulate a joint so it could move better, but you're talking about a technique that increases the ability to have this cushion, kind of like riding on a little cushion of air, like an air hockey thing or something.
Yeah, if anybody wants to stop by your office, you could show them the difference between doing a little bit of a knee mob,
Yeah.
and then getting up and you're doing the muscle energy or the helix work on it, and they can actually feel what joint space is.
Yeah, I'm
So
going to
they-
show one more thing. This is and you've seen this video before, but it's after 2 hours of the helix biomechanics. We did the diaphragm, the strain counter strain, and then
Yeah.
we did the for the arteries and veins going in and out of the heart, and also
And
the diaphragm.
she's got the bend bounce, right?
Yeah, but
There's that.
this is before. So and she's a good runner, here local runner. So this is before. She's pretty good, but you know, she's kind of going up and down, and she's going along.
There's a tight stride there.
Yeah, and then we're going to show one more time. This is the before, and then it takes a little while. Sorry about that, you guys. But then you'll see the after. So she's going to come back, and this is still before. So just get a sense of how big her stride is and how her foot lands. It kind of comes down on the ground. And now this is after 2 hours of what Tom talked about, the helix biomechanics and the strain counter strain and descended phenomenon. And this is what she looked like afterwards.
There's a lot more of heel kick in there and extension of the legs.
Yeah, and her foot's pawing back. Instead of just going up and down and hitting the ground, she's kind of hitting, and it's like she's on a skateboard pulling that skateboard through. So that's 2 hours of what Tom taught me over the years. He's taught me a lot more than that. But so that's the idea. And we've got strain counter strain that restores the muscle spindle. We have the helix biomechanics and also the mobility templates that restore that quanta, that energy cushion in there. We have other things I want to talk just briefly about this part. One of the techniques that Ben loves me to do is he'll say, hey, the hamstrings are tight, the quads need work, and I'll do bone bruise technique. And you taught me that so well when Jen was pregnant. And I would do one side of the body and do bone bruise technique. And then he would get up and that whole right side was totally loose. And then I would do bone bruise technique to the other side and loosen him up. And instead of stretching out tight hamstrings and stretch, you know, I worked on the bones and it improved everything. And I told him tell me what you think about this explanation and what your explanation would be. It's kind of like if you have a bone and it's got this lattice work of, you know, kind of Buckminster Fuller, kind of like a spider web of trabeculi. And if part of it is compressed, it's kind of like you've lost that space in there, and bone bruise can help like puff up the bone and get it restored. So all of it works like a little helix, like a little three-dimensional lattice work. Tell us a little bit about the bone bruise. We could talk about a lot of different IMT things, but bone bruise is a phenomenon that only IMT has, as far as I know. Other people know about it, like the doctors found it with MRIs as a source of pain and problems, but tell us just a teeny bit about bone bruise. I've kind of got you here captive for a bit.
Oh, that's like pinning me in the corner. Thanks, Ralph.
Oh yeah, I'll let you go. It's like, I know it's getting close.
No. A bone bruise is a phenomenon we found while we were treating all different organs of the body. The bone is actually a living organ, and it produces red blood cells and white blood cells and lymphatic cells besides being the structure. And everybody in Western medicine really perceives it as a solid rock, you know, because we study from plastic and um, uh, it has pliability to it. So on Monday, I went down to Sacred Heart University in the lower part of Connecticut, and I was the dean of the school and I are getting to be friends, and he took me to the cadaver lab for 10 minutes, and we were playing with bones. And he had a dissected femur. I was going, look, because, and it started bending the bone in my hands because it still has formaldehyde in it. And he goes, wow, that's amazing. So bone is like cartilage with extra calcium in it. So it has some pliability. It should actually be pliable and bendable. So when you get a tear in the bone, we call it a bone bruise. So it can be from a little micro tear. If you had an apple, it'd be like splitting the skin on the apple, or it could be an indentation like you drop an apple, or it could be like you crack the apple in half. All those can be fixed with a bone bruise. And it's really a part of quantum physics and looking at how the structures of the individual cells reset themselves. But we have a technique that appreciates that quantum physics and a diagnostic where you have to sit there and analyze that crack in 6 different ways. And when you set up that form of diagnosis and you just hold it there and you create the fulcrum, we actually have a case study of one of our students who went rollerblading in the 90s, broke his wrist because he fell on it. Had it worked with an orthopedist. They got an X-ray in the cast. Came down the following day. We did the bone bruise techniques through the cast, and he went back for another X-ray, and it was like a 6-month healing of the calcium already attracted to the bone at that point.
It's an awesome technique. And
There are many systems that we've discovered because we were always asking, and this is the hard belief system, is I'm sure for your people that are healthcare practitioners, like they take classes and they understand a little bit, but there's always a question, well, why didn't this correct, or why did this feel different than that? And we were 300 doctors and therapists coming back with those questions. So we can tell you when some muscle relaxes, is it an artery, is it a vein, is it a lymph node, is it the bone, is it the connective tissue? And all those actually have different feels in the body. And when you start to calibrate them, you could be there more specific, more clean than just taking a piece of wood or a foam roller and squeezing out and trying to mash it. And my example of that is if you had a knot in a gold chain, you have to loosen it up and pull the strands apart to untangle it. And most injuries are untangling injuries, unless there's a knife that went through it or a piece of glass that went through it. The tissues have been bound up and are stuck like this, and we're just trying to smash them apart instead of logically unhooking them so they just come apart and be free in their movement. So that's the indirect technique that makes IMT and structural medicine totally different than what you go before. And I challenge everybody that thinks we're full of, not really, why do we say this instead of that? Give us a try and we can prove it to you that, our techniques are slightly different, and the methodology of diagnostics, right? And Ralph, we spend 2/3 of our times making the right correction instead of just hitting things over and over again in that whole process. So IMT is taking the structural medicine and feeling where it's broken and opening it up.
yeah, I liken it to somebody told me this. It's like having those super shoes with carbon plates, but throughout the whole body effect. It has a bounce to it, that a recoil when you get this thing right. So that's, and what I'm looking for is to see how to get this kind of message to those guys that have great physios and chiros, the elite people in Flagstaff, and that's one of the main places they are. This kind of information, because it is different and it is unique, and it works in a different way to restore not just the mobility, but this space and this rebound effect. So thank you, Dr. Tom. This has been really good. I'm gonna
So here's one thing: if they don't know what they don't know, how do they know they're missing it? So
yeah.
that's the challenge of education nowadays. After we get a lot of PhDs and everything else, we get embedded in, we know the best knowledge. And every time I've taken a class, I've had 10 more questions.
Yeah, and I was doing my talk for the Fairhaven Association earlier and saying over the years, 40 years for me, It's like we test, we do something and we retest. And after doing that over and over again, we can see, oh, this thing helped this problem. And we may know the science of it, or we might not yet. But we know that when we see this and we do this thing, this gets better. And then sometimes the science gets filled in and we can understand more of why this works. But it's quite a journey. And I really appreciate having you as my teacher over these years and doing these podcasts and just being doing this work. So yeah, reach out to Dr. Tom, IMTWellnessCenter.com in West Hartford, Connecticut. And he is at, let's just get the phone number, 860-561-2286, IMTWellnessCenter.com. And I'm at 360-599-2217 in Fairhaven in Bellingham, Washington. And if you're dealing with a chronic injury, a chronic problem, if something's not getting well, and you've been working on joints and muscles and tendons and ligaments and or other things, other chronic health challenges, reach out to us and we can do the mapping. We can find what we see as the primary cause and get you some answers. So so thank you, Dr. Tom. Appreciate you very much.
Hey, Ralph. Thank you.
Thank you so much. Okay, I'm going to share this widely and I'll send it over to you in just a little bit.
Have a great day.
Have a really good one.